Welcome back, and I hope you've all got a coffee or tea or whatever your other drink is. We have a slight change to the next panel, which is All Policies for a Healthy Europe, a presentation on the Digital Working Group recommendations. The slight change is that sadly Darren Ennis has become unwell this morning, so is unable to moderate. So I am going to step in to perform his role. So please forgive me if I stumble over any words or I don't appear as well prepared as Darren, I'm sure, would have been. So it's hello and welcome to the All Policies for a Healthy Europe session at the Digital Health Society Virtual Summit. All Policies for a Healthy Europe is a multi-stakeholder coalition geared towards improving citizens' health and well-being in all relevant areas of EU policymaking. To know more about our coalition, please visit the exhibition space provided today. For today's discussion, we welcome members of the Digital Working Group of the coalition. The Digital Working Group is chaired by me as Deputy Chair of the ECH Alliance. And All Policies for Health would like to thank the ECH Alliance for its contribution to the policy paper. The Digital Working Group has indeed been working on a policy paper focused on how the European Union can ensure that citizens are fully empowered and truly engaged in the development of digital health and well-being. So let's take a look at the policy paper and we'll now play a short video. Thank you. So let's start our discussion. And you are welcome to connect and react using the Twitter accounts at Wellbeing EU, at DHSS Society, at ECH Alliance, or the hashtags Wellbeing, EU Digital Health, and DHS Summit 20. So the first thing I'm going to do is ask for a quick tour de table so that the individuals can introduce themselves. And if I start in no particular order with Francesco, over to you.
Yeah, good morning. Francesco Buonarroti. I am the CIO in EMEA of Johnson & Johnson. And very, very humble and privileged, I think, to be here. I think it's a very important time in Europe for what we are discussing. And I think it's time that in Europe we can harness the technology development and digital transformation in order to improve care for citizens, improve research, and also shift really our healthcare system to real value-based system.
Thank you. Michele?
Yeah, good morning, everyone. I'm Michele, Policy Advisor at the European Patients Forum that, as you know, is is a European organization representing the patient community, both across disease and across country. Digital health has a great importance for us because it can have impact on several aspects of chronic care patients' care, empowerment, integration of systems, system efficiency, improving quality and access to care, and of course revolving around the point of digital health. And we are very happy to be part of the All Policies for Healthy Europe community and working with colleagues as we have today on the recommendation and the policy paper, which touches a lot of important points from us, from digital health literacy to building trust and including the views of citizens in developing all the new frameworks for digital health, from the health data space to AI. So looking forward to the discussion.
Thank you. Michael?
Hi, my name is Michael Strubin. I am Digital Health Director at MedTech Europe. MedTech Europe is a trade association for the European medical technology industry, including medical devices, IVDs, and digital health. And we, as an industry, have a keen interest that digital health can deliver, can contribute to the digital transformation of health and care, because we see the same potentials as Michele and Francesco have just outlined. And we're also very happy and proud members of the All Policies for Healthy Europe coalition. Thank you.
And before I ask the first question, if I can just explain to others what's behind the name All Policies for Healthy Europe. The basic idea is that every policy area that the European Commission are involved in, and the European Parliament, every sector has a relevance for healthcare, and that healthcare should be being considered in all policies that are developed. So, for example, in relation to transport, pollution has a major impact on healthcare, whether that's such things as asthma or COPD. And that's an example of what All Policies for a Healthy Europe is about. So it makes sense to some of the people. So first question then to Francesco: what value can using health data effectively bring to citizens, and what role should they play in the health data ecosystem?
Well, I think that this is, let's start with the value of data. I think data collected in real life settings, and we speak, I think, about real world data, can help drive a new understanding of value and supporting healthcare decision makers faced with challenge of assessing different forms of technology and treatments in the context of fixed healthcare budget. And I think the pandemic will not relax the fact that we have fixed budget in the future. This can include a range of routinely collected data sources that we all know: electronic health data records, hospital database, electronic registries, and insurance claims, but also the wearables, apps, and device-generated data, amongst others. I think a connected and sustainable European health data, healthcare data ecosystem, and greater trust and acceptability of real-world evidence in Europe will enable to shift towards really value-based healthcare models and systems, ensure that Europe remain relevant for clinical research, that more patients can join targeted treatments and trials, and also advance the use of outcomes-based payment models where the cost of care is linked to the outcomes it delivers. This is in turn will reduce healthcare inefficiencies to help to meet the challenge of today's. So if we go to the data and the citizen part, I think data should be collected and used to allow citizens to manage their health and take more evidence-driven decisions, while giving healthcare professionals and other stakeholders the ability to improve and personalize diagnostic, personalized treatments, personalized services, and personalized products. I think the digital transformation that we observe in our societies and the advance in healthcare technology are provided larger and better quality data sets. However, I think it is, and we are here because much of the data remain locked in silos, preventive valuable information being captured, analyzed, and applied to care value delivery, so improvement decisions. So what we call the European Union is to support member states in enabling all citizens in Europe to have access to their full electronic health data records, including patients' reported outcomes, and be able to easily to share their healthcare information with healthcare professional stakeholders. This will enable the proficiency of high quality and safer care for patients while improving financial efficiency and support better policy decision makers and ensure evaluation of treatment effectiveness based on real clinical practice. Second, I think we have to establish a clear and user-friendly guidelines to facilitate data generation, access to qualitative data sets that are public owned or voluntarily shared by private sector. And we also believe that private individuals, the citizens who wish to donate their data for good, should be incentivized to do so through concrete initiatives. I think control over the data should remain with the patients and citizens themselves, and they should empower to access and manage their own healthcare data.
Thank you. And any comments from the other panelists?
I think there are no comments.
I can maybe add quickly. Indeed, for us, the use of health data it is particularly important and interesting to follow, and we're also really looking forward to what's going to be the discussion around the European health data space and how that's going to also be developed with in mind having the point of what health data can bring in terms of value back to patients from sharing the data. And we're also very much working on it through several projects like Data Saves Lives, which is also mentioned as a best practice within the All Policies for Healthy Europe paper on really raising awareness on the topic to ensure that there is this creation of this critical mass of data that will be, I think, at the center of the health data space discussion.
And I think we had earlier Iona from DG Sante talking about the European health data space and the fact that she was in listening mode. And this is why some of the work of All Policies for Health in terms of expressing a view in the policy paper and making recommendations is so important, isn't it? Because for you, for instance, Michele, representing patients and wider citizens, since we're all patients at some point in our life or our family are, this is about why not just staying silent at the moment, but it's very important to articulate views.
Absolutely.
Yeah. Okay, so Michele, the next question is, EPF has recently launched a study to better understand what patients think of AI. What are your first findings, and how can the EU better involve patients and citizens in the development of AI in healthcare?
Yes, Vladin, thanks. Indeed, AI, it's a topic that it's growing in terms of importance for us. And as you said, to better understand where our community, our membership stands, we launched this survey, which is still has to be finalized in terms of analysis, but I can indeed share some of the trends that actually, and this is quite interesting to see, they're very much linked also to some of the recommendations mentioned in the paper that we have developed, and very much linked to our response to the white paper on AI by the European Commission. Very quickly, we touched a topic such as knowledge, perceived use of healthcare, of AI in healthcare, the most interesting aspects and worries, but also trust and the level of knowledge and literacy needed. In terms of perceived knowledge, we recognize that from the responses, the level of understanding on AI from the patient point of view is still mainly basic. So there is an understanding of what AI is, with only few, let's say, example of really good high knowledge on risk and application, which is of course very important because it's very practical in terms of impact. And this is very much linked to how patients perceive the use of AI in healthcare, because especially for patient organization, there's still the kind of limited knowledge about whether their community actually uses concretely AI. And this might not be a matter of using it or not, but really a matter of understanding that the tools that they're using are in a way AI powered, which is of course, which is something that still stays in the kind of gray area for if you don't understand what is behind the tool that you're using. But we also had a very clear identification of what patients are really looking forward in terms of AI. And there are several elements. In particular, we noticed that patients are very looking forward to AI as a tool to support healthcare professionals in delivering better and more personalized care, which is quite important. It can also have a big impact on self-care and provide more information, adherence to treatment is just an example. Improve, therefore, quality and efficiency of diagnosis, but also research and innovation, and in general, support health system efficiency. So the responses really identify all these kind of elements that can make AI a key tool for within the digitalization of care. Of course, there are several challenges that patients are still kind of facing, and they're linked to a little bit what I said before. So so far, there's a perceived lack of involvement in the co-design of AI solutions, and a little bit of a gap in terms of understanding, in terms of transparency on how AI work, how the quality of data is ensured, how the training data and the outputs will be used, which is very much linked to the health data, let's say, worries and challenges. And of course, the risks that could be connected to AI in terms of incorrect diagnosis, lack of clarity on liability. So in case something happens, who should respond and who should the patient go to? And especially, of course, a risk of reduced human interaction with the healthcare professionals. And to conclude, the other two elements that we have analyzed are the level of trust, which is overall sufficient, but there's a strong impact on whether the healthcare professionals the patients are in contact with would kind of help patients understand and engage with AI. And last but not least, in terms of knowledge we need to build, I think it's very important for patients to have access to at least basic knowledge on how AI work, on the risks and the rights in case of errors, and how AI outputs are used. And to refer to the second part of your question, how we can basically involve the patients and citizens community in the development of AI in healthcare, I think it's a matter of investing in making citizens understanding what AI is, as in terms of basic knowledge and in terms of interfacing with the systems and knowing what are the risks and what are the benefits. And at the same time, there is the chance also at EU level with the follow-up to the white paper that was published this year, where patient organization will be able to have their say. So I think it's important from one side to build the knowledge on a very new topic that is evolving very rapidly, and from the other side to have that space for the recipients of this capacity building to act and develop both the kind of innovation itself, but also the policy behind them. So,
Michele, thank you. Michael, have you got any comments on what Michele's just said?
You're on mute.
Mute.
Here we go. I was actually busily taking notes with Michele, and I think I was actually picking up notes already, thinking that I may want to reflect on these when I talk very briefly, and I will talk about in a minute about the recent report that we put together. There's quite a bit of haziness about. There's a mystique about AI, I find, and this is a little bit reflected. Michele, you mentioned that patients are very much putting hope in in AI because it makes healthcare so much more efficient. The report that we put together recently actually indicates that one of the biggest potentials of AI is actually in the devices, in the wearables that people carry with them, and that make them help them make better decisions. We completely agree that there is a lot of knowledge gap, that we need a lot of training for healthcare professionals and citizens regarding AI, and that also is borne out by some of the findings from our report. So I'm actually really eager to move to my quick update to tell you more about that report that I just talked about.
Okay, well,
yeah, perhaps one aspect that Michael was just indicating. I think there is a clear recommendation for the group to increase the trust in AI, also to make sure that we have a training and retraining of the healthcare force, making sure that no one is left behind. I think we cannot be increasing patients' confidence if the healthcare stakeholder they relate to don't understand what exactly is. And this is also a clear recommendation to the European Union to making sure that the action plan have enough funding, making sure that the healthcare force has proper training for that, and also that we encourage also member states to put the right training in place for healthcare professionals.
Thank you. I'm going to have to apologize at this point because you might start hearing my dog, who's just come back from his walk. He's very excited round by my legs. So if you do hear anything, that's apologies. Can I just, before we move on to Michael, to your thing, can we just stay on AI for a second? So I see a lot of startup companies in digital health who come to see us, and I just fear at times that AI has the potential to be the new emperor's clothes, because it's almost like the buzzword for some people who've got startup businesses, and they think that if they use the term AI, we're all going to be, sort of really impressed. And truthfully, they just might be using an algorithm, and there isn't any real sort of AI. And I guess one of the issues here is actually, what do we mean by AI? And is there clarity around that? Do you think that that's a concern, that if we're not careful, industry and the small businesses and startups actually start to break down that confidence and trust because they're using it inappropriately, really? Any views on that?
I can maybe link to what was said. I think in general, as I mentioned, like one of the findings of the survey is that there's still maybe not 100% understanding of whether the solutions are using AI or whatever it is, or just algorithms or something. So I think it's important, as with everything that is digital, to have a kind of understanding on the terms themselves, because confusion does not help with trust, as you said. Confusion does not help with trust. The confusion also does not help to really focus the education and skill building that is needed, both from the patient, citizens, community, but also the healthcare professionals, which we've seen, and as Francesco has said, as the main interface for patients on AI as well, to increase the trust and to trust more digital health in general, but also AI. So yeah.
Anyone else have a view?
Yeah, well, I think we have here, we speak about digital health, and I believe we have to be cautioned when we speak, because artificial intelligence is used in every industry at this point in time. I think it's a buzzword in every commercial that we see. And it is here we are connected to health. And I think we have to unify two words. And I'm spending a lot of time with startups and looking, and we see very innovative idea and less innovative ideas or just apps. I think at this point in time, there is a lot, and that is good. There is a lot entrepreneurial spirit on that, but we have still to apply our health process, because we speak about still health of people, and we speak about patients at the end and therapies, and that's, I think, what we're industry and all stakeholders of the healthcare have to apply when we look at this.
And I'm just looking in the chat box, and there's a couple of questions coming in for us. So the first one is around sort of AI use, and what would be the AI use without harmonized exchangeable health data? Anyone want to pick that up?
Well, I don't want to repeat what I was telling in the beginning. I think it partially is answered, because whatever we speak about intelligence is based on data. And I think it's a tipping point for Europe and for our policymakers. We have our ethical approach, which is good. We have our GDPR, which is good to protect ourselves, but we have also to find the possibility to exchange data, to have clear interoperability of data, the typical fair approach of data, that we can use it and we can move on. We have the science, we have the technology, but without data, it's all nothing.
And it's then about the quality of the data as well, isn't it?
Yeah.
That it's got to be interoperable, and the data has to be reliable. The other question before we move off this topic was, should the guidelines for trustworthy AI developed by the high-level expert group be customized and made fit for purpose for AI in healthcare? Do we feel strongly about that?
Well,
one thing that we always need to keep in mind is that there is always a tension between on the obligation, the legal obligation, and the ethical obligation of healthcare to deliver good quality healthcare, to deliver safe healthcare. And so when we talk, for example, about considerations of data protection, for example, about ethical use of AI, we always need to balance this with the requirement for a healthcare professional to always deliver the best quality healthcare and to save lives. And I think that is always something that needs to stay in tension. And we need to find the right balance there.
Yeah, I mean, I think getting off the fence for me, I've always thought that GDPR isn't necessarily fit for purpose for healthcare, and that it could be adapted to healthcare, which would make this whole question about interoperability of data and the use of data and access to it much clearer. And I think this is probably quite an interesting area as well around AI, and whether specific rules for healthcare might be helpful in terms of a faster adoption and actually a better use. But I'm conscious of time, so let's move on. So Michael, the next question is for you, which is, MedTech Europe has recently launched a new report on the impact of artificial intelligence in healthcare. Can you tell us more about it and how citizens' empowerment in digital health is reflected in the recommendations on AI?
I'm very pleased to do that. Thank you very much. And thank you for giving me the permission to just show a couple of visuals, because I thought they were very useful. MedTech Europe recently published a report together with Deloitte, which really means Deloitte did the work and we paid them money to do that, to perform that work on the socioeconomic impact of AI, building on my earlier point that there's quite a bit of confusion about AI. And we talked about this earlier in this panel here as well. So we asked Deloitte to actually tell us what actually could be the actual benefits of AI if we use it in European health systems. So what Deloitte did for us, they looked at the number of different use areas, medical technologies, and they sliced and diced it into 8 different pieces. I think whether it's AI or whether it's just simply smart algorithms, smart software powering these, the overwhelming majority of the overwhelming benefits, in fact, will be delivered by wearables. We also looked at imaging, which of course is more, making radio images better, doing image recognition, automatic image recognition, and helping radiologists and other doctors analyze images, medical images. I think is a big impact. Labs and monitoring also stand to benefit greatly, but really wearables is kind of the low-hanging fruit, so to speak. The overall findings of the report is that if we get everything right and we adopt AI in healthcare, then AI has the potential to save every year 400,000 lives. Incidentally, wearables is 3/4 of that AI could save. It could also save 200 billion euros in saving, which is more than 10% of what we spend in Europe annually on healthcare. And we could free up 1.8 billion hours every year, which really the equivalent of having almost 500,000 extra full-time healthcare professionals in European hospitals and doctors' offices delivering care. And the idea is not we can now finally get rid of 500,000 doctors and nurses. We need them, but we can free them up to focus on higher value tasks. The policy recommendations very much reflect and align, in fact, with the policy recommendations that we delivered in the All Policies for Healthy Europe. There's a lot. We need, of course, the right policy frameworks and the right balanced regulatory environment. We need clear governance and partnerships. We also need to look at commercial incentives, data interoperability. Bledin, you and others mentioned this several times today. And one of the key items here is the building the skills among healthcare professionals and digital literacy among citizens so that we can take full advantage of AI. I'm not sure I can share with you the link to this report. It's not entirely easy, and I'm not sure I can send you the link for download, but it is available. It is findable on the MedTech Europe website. If you look for it persistently, I also have a QR code here. I invite you to take a look at this and the report and spread the word, because these are really a set of compelling and powerful messages, we believe. And with that, I'd like to close here and welcome your questions.
So if we can, first of all, go back to Michele, do you have any comments you want to make about what Michael's just shown us?
No, I think as we were saying, there are a lot of let's say common points that we could see, in the reflection we had to the survey and the All Policies for Healthy Europe paper and the report itself. So I think in general, it's just very important to build the knowledge and make sure to have a clear understanding of what AI could bring, in general to citizens in a very clear way. I do believe that transparency and knowledge always help to create more trust. So I think that's the starting point, especially on a topic that is evolving so rapidly, such as AI. I think.
Francesco, have you got anything you'd like to add?
Well, I think, I come back to how do you make all this available? I think how do we grow the digital health system together? So you speak wearables, generate data. We have our data, we have genomics. We can bring really healthcare to a different level. And that's we have. But we need the right policy, the right trust, the right security. There's no doubt about it. But we can bring healthcare to a different level, and that's I think what is today possible, and that's I think is the commitment of the people working in healthcare at the moment and in technology. And
I think Michael's slide where he started showing the benefits of AI answers my question earlier on about the emperor's clothes, because those were very tangible, very specific benefits to individuals, to healthcare systems, to society. So I don't think there's any doubt that of the potential for that. One of the questions where we talked about access to data. I mean, this morning, Jesper from the Danish Medicines Agency had talked about how important he felt consumer data was going to be in the future, and that it was going to dwarf the traditional, if you like, electronic health records that exists. And one of the things that I know that we talked about in our working group was that in Scotland, for example, Professor George Crooks, who leads the Digital Health and Care Institute, he's created an exchange platform where consumers can upload their wearable and IoT information. And that platform can then back end information into the individual's electronic health records. And I'm just wondering whether we think that that's the way that some healthcare systems may be able to scale quickly this consumer data, and whether what our thoughts are about that. Want to jump in?
Well, I'm a big fan of what George and his colleagues at NHS Scotland have done. I'm particularly familiar with the diabetes, my diabetes platform, and I'm not sure this is the one that you're referring to. But this is of course always where we then run into some of the technical issues. Ideally, I very much welcome the idea of creating almost what is a digital twin, a kind of a low cost version of a digital twin where I upload my data and make it available for myself and the healthcare professionals. But how do I take my Fitbit data and upload it? It's not clear. There is no clear and easy way to do that. And that's always where we run into some of the technical issues. But we will, once we solve those technical issues, we will find out much sooner that actually people are, when you ask them, they are much more willing to share their data than we would commonly think.
Yes, I agree with that. Anyone else got any comments on that? Okay, so I think I
can comment.
Yeah.
I thought Francesco was coming in, so I was leaving. But very quickly, yeah. I mean, one point also in our work on data in general is really make sure that there is easily accessible platforms and everything else, because I think it's a matter of what Michael was saying, you know, like the tools are there, but how it actually works for the individual citizens. So we're not talking about, you know, even patient experts with background in digital health, but really, you know, the individual citizen, the individual patients, that's where, you know, eventually data will mainly come from. So that's one point. And the other point, I think, especially since we're trying to move towards this EU health data space and more work at European level coordinated on digital health, I think it's important to always keep in mind the issues of inequalities in a way and difference in terms of digitalization of the countries, because yeah, you mentioned Scotland, which is very much at the forefront of all these experiments as well. And we have the other examples like Estonia, Finland, and so on. But if we're moving towards a European health data space, we also need to avoid forgetting about, you know, countries and member states and therefore citizens that might not have access to that at all in some cases, or very limited, both from the knowledge, access, and even the digitalization level in general.
Very good point. So the digital divide, the fear that we exclude people or that we increase inequalities of access to healthcare services is something that we must not lose sight of, and it's clearly critical.
Indeed, yeah.
Francesca, were you going to say anything?
Oh, we can speak a lot about all the points. I was just, perhaps we just let us the last question if there are some others, because I think that Michael and Michele really answered so important aspect of it already.
Perhaps one item on the equality on one thing that I think we can all agree on is that digital health and AI and some of these platforms will dramatically lower barriers for access. And I mean, this will be a benefit, I think, for everybody. Having a virtual technical assistant or a digital assistant that tells us, that can crunch data about how we move and how we sleep and what we eat, and can help us and give us real-time technical advice. I mean, we can see a future where this type of advice, this type of coaching will be available, not just for, you know, the few professional football players and actors and millionaires and billionaires, but will be available to everybody. Now, is it a task for everybody to then get a state-sponsored or government-sponsored technical device? I'm not sure we can go that far. You know, a smartphone is now sufficiently democratic, but I think we can lower the price and can lower the barriers for everybody. And I think everybody will benefit in the end, provided we give them the skills and the knowledge and the know-how to use these types of devices.
Yeah, and I think in our working group, we started to look at examples from around the place, and two struck me as very relevant. The first was financial services, so Barclays Bank in the UK, who have a program called Digital Eagles to make their customers, if you like, more street smart about the use of digital tools. And obviously that's partly designed to reduce financial fraud. But the upside of it is that they've targeted healthcare. And during the pandemic, they've trained 500 care homes around the United Kingdom in digital skills to allow residents to be able to speak to their families using tablets. And I think that the opportunity for healthcare is in this digital literacy and area is to tap into the resources of other sectors who have a mutual interest in building digital literacy and skills. And then in the same way, from professional sport, the Welsh Rugby Union have developed an education program, which they call digital schools, where they have some of their coaches going into primary schools, secondary schools, and teaching the students about diet, healthy food, lifestyle, and education. So I think what in our working group we're trying to do, I think, is to encourage the wider involvement of not only all policies, but all sectors involved in assisting the goal of creating better healthcare systems, more sustainable and digital transformation. So I'm conscious of time, so I'd like to sort of conclude and thank you all for your contributions. The discussion is just a taste of the recommendations and topics tackled by the Digital Working Group of All Policies for a Healthy Europe. If you'd like to engage with us or receive our final paper, please send an email to Candice and you'll find all of her details in the exhibition space. If you'd like to know more about the coalition and the events organized with Euroactive a month ago about empowering citizens, the key to a successful digital health transformation, we encourage you to check out the link in the exhibition space. But thank you for following the discussions and enjoy the rest of the virtual conference. So thank you all.